Hi, I'm Mel Fuller, and I'd like to introduce you to Deb Patterson. She's the Democratic candidate for Senate District 10. Hi, Deb. Thanks for joining us.
Oh, hi, Mel. So thank you so much for the opportunity to be with you today. I'm really grateful for this chance to speak with everyone who is interested in the very many issues that Northwest Senior and Disability Services are working with and others in the community.
Great. Let's get started with the questions. All right. Okay. Question number one, Deb, tell us about your positions and your experience that would encourage a senior or a person with disabilities to vote for you.
Thank you. Well, as the mother of a young adult with disabilities, I've been advocating for people with disabilities for over 20 years through the educational system, through the healthcare system, and through legislative advocacy. For the last 7 years, I've been a member of the Marion County Intellectual and Developmental Disabilities Advisory Board, and more recently, I was appointed by Governor Brown to the Oregon Disabilities Commission. In my capacity there, I also serve as an ex officio member of the Governor's Commission on Senior Services. In the nearly 3 decades that I've been serving as clergy, I've worked with myriad older adults in the community, in their homes, and in long-term care. And for 20 of those years, I worked in faith-based health care, primarily working with older adults, including a decade at the helm of an international health organization, working with RNs around the world, helping folks of all ages and abilities lead healthy lives.
Wow. Oh, okay. Question two. Oregon Project Independence is a cost-effective program that's kept seniors and people with disabilities in their own homes. Yet every year, proposed funding for Oregon Project Independence gets cut. If elected, what will you do to protect the funding for Oregon Project Independence?
Yes, as I mentioned, as the director of the International Parish Nurse Resource Center, which is now called the Westberg Institute, for a decade I worked with RNs around the world to help people, mostly seniors and people with disabilities, lead healthy lives and access and navigate the healthcare systems. We also advocated for better community access to mental health care and substance abuse programs. Almost always the best option for seniors and people with disabilities is to have the opportunity to stay in their own homes. I was excited to see in the past couple of years the pilot project to expand Oregon Project Independence to include more people with disabilities. Honestly, looking at the projected revenue shortfall for the next several years, I don't know how we can afford not to take a good hard look at the costs of institutionalized care versus home care and invest significantly more into Oregon Project Independence, which can be more cost effective as well as generally preferred.
All right. Thank you for that answer. Next question. Number 3 is, how would you prioritize state funding, including funding matched with federal funds, such as Medicaid, for services to an increasing senior and people with disabilities population?
Yeah, given my personal and professional experience, I hope you can see that I would certainly prioritize state funding for seniors and people with disabilities. I especially don't want to leave dollars on the table that are matched with federal funds, such as Medicaid, as you mentioned, and funds to help with healthy nutrition, such as funding for Meals on Wheels and other food benefits. I also believe in leveraging funds at every level and partnering with community stakeholders to increase access to needed services and to develop new programs and services such as the Memory Cafe movement. I know that Center 50 Plus has a wonderful Memory Cafe program, services for people living with Alzheimer's and their families. Every Oregonian deserves access to safe housing, nutritious food, and the healthcare services they need.
Okay, thank you. Question 4. During this time of increased risk of homelessness and food insecurities, what will you do on a state level so that seniors and people with disabilities no longer face a lack of accessible and affordable housing and receive appropriate nutrition?
I have to say that actually this is not just a state issue. We need to address the cuts to HUD, which has been cut nearly 75% since the Reagan era. which is one of the many reasons why this next election is so important at every level. Similar cuts have been recently proposed at the federal level to programs which help address food insecurity. And frankly, I'm worried that there will be cuts to Social Security and Medicare as well if we don't make a change in the direction we're going. Here at the state level, we need to work with every partner we can to address policies that are barriers to creating more affordable housing, for example. I was glad to see legislation recently passed here in Oregon that required zoning in urban areas for middle housing, such as duplexes in neighborhoods previously zoned for solely for single families. However, I've seen a number of these new duplexes going up, and sometimes the design doesn't fit with the neighborhoods and overshadows neighboring homes. How will that make the new residents feel? They won't feel welcome if their large homes overlook and look down into other people's backyards. I think we have to work together for an Oregon that works for all. Affordability in housing needs to be addressed at every level: federal, state, county, city, and neighborhood association. And the same goes for food insecurity. No level of governance should get a pass on these critical issues.
All right. Last question. I wish there were more. I'm really enjoying this interview, Deb. Thank you.
Thank you.
What are your plans to improve the health of vulnerable seniors and people with disabilities, including people of color who traditionally suffer from more health disparities due to pre-existing conditions?
Well, it's awfully good to see more of us waking up to the realities that racial disparities exist between people of color and others. We certainly are seeing this. The COVID-19 infection rates and death rates have shone a bright light on this issue, as have other issues that we see around us. People of color have higher rates of diabetes, cancers, heart disease, and respiratory illnesses than others because of so many things. Disparities in income, which impact food and housing options, environmental factors, disparities in schools, which affect educational outcomes and future income, access to healthcare providers, treatment by the healthcare system, and the stress caused by racism itself. I'm gratified to see the work being done this summer by the Black, Indigenous, People of Color Caucus at the Oregon Legislature. It's a good start. We have a long way to go in our schools, in our healthcare systems, in our legislature, in our communities, and in each of our neighborhoods.
All right, Deb, thank you. Thank you for taking the time from your day to participate in this video.
Well, I'm very grateful to you and for this opportunity, and I hope everyone stays safe and well during this pandemic, and that we are able to safely move forward into a way we can get out there and be with each other again soon.
Yeah. Whew. Once again, everyone, this is Deb Patterson, Democratic nominee for House Senate District 10. Deb, thank you.
Thank you.